Hi everybody, my name is Stephen Ferry. Welcome to my channel Perfectly Homeless. Today I want to talk about recovering from micro disc surgery while being homeless. I didn't necessarily recover in my car, but I want to talk about the process because it took me a while and it was pretty stressful to figure out how to do it. Long story short is I've had numbness in my feet and pain in my back for quite some time now due to a bulging disc, L4 and L5 to be exact. I finally got approved for surgery, which was a huge undertaking. They make you go to a pre-operative interview where they put you on a cardiogram and make sure everything's okay, and it turned out I had some other issues with elevated heart rate or AFib and a leaky valve too, so that kind of postponed it for a while. So within that time I was able to prepare mentally for the surgery, and I also kind of was trying to make plans where I was going to recover because I knew I didn't have any place to go. I was going to stay with my sister originally, but she moved into a smaller place that was up quite a few steps, and it just wasn't the right situation for me to recover. So when I signed up and got approved for surgery, I told them that I did have someplace to go and someone to help care for me during recovery, but that changed. And when I got admitted to the hospital, I don't think they really knew that I was living in my car. So 2 days after the surgery, which went off spectacularly, I didn't have any complications or anything like that. I arrived at 6. I was on the table by 7. I woke up in my private room with a couple of nurses fussing over me, and they took great care of me. And 2 days later, they were ready to kick me out, and they're asking me, "Are you ready to be discharged?" And I kind of pulled my nurse aside and I said, "Can you tell my doctor that I have nowhere to go?" And this got the ball rolling. Next thing you know, I had a bunch of physical therapists coming in asking me, "Where are you going to go from here? And exactly what are you going to do?" And I explained to them how I get in and out of the car and got to crawl into the back to get to sleep. And they immediately deemed me it would be an unsafe discharge at this point. So the hospital discharge staff made arrangements for me to go to a skilled nursing center, but the skilled nursing center wouldn't accept me for the same reason. I didn't have an address or anybody to be released to. So something happened where one company said, "We'll take him after the skilled nursing company." So I got in, and it was took a lot of planning to get there. And one thing I wanted to point out was I was very concerned about where I was going to leave my car, because everything I own is in here, and I made arrangements with the hospital to park in their parking garage on the lower level, and I called security and said it was going to be there for 2 weeks, and they didn't have a problem with it. It still caused me a little bit of stress because I didn't know if the car was okay or not. As I was arriving at the hospital at discharge, I was kind of stressed out because I was wondering what I would do if I had no car and all my belongings were gone. But that didn't happen. Hospital was cool. So that's the first thing I want to say. If you're going to schedule yourself for surgery, make sure you can arrange where you can put your car in a safe spot. Chomp Hospital was really cool about it. Just make sure you let security know the tag number and who to call in case of emergency. Getting back to the surgery, like I said, Dragon Dimitrov, the surgeon, Dr. Dimitrov, great guy, super nice, the best bedside manner you could ask for in a surgeon. He was really super nice. He didn't have to take my case. I had heard about him from another patient of his who does physical therapy at the gym, and he recommended him, and he happened to be on the same team as my prior surgeon, and I contacted his office and I asked if he would take my case. He looked at my MRI and said yes, he would take it. He thought he could help me, and he actually thanked me and said thanks for putting your trust in me before the surgery. So I had a lot of confidence within him, and that took the pressure off me worrying about him, because the guy does probably 5 or 6 of these a week, and he's just a great guy to talk to too. So the surgery went off really well, Didn't have a problem with it. 2 days into it, they're ready to release me. Then the hospital staff kind of made arrangements. I got switched to a skilled nursing center, and that was really kind of necessary and interesting because it was interesting because there was a mix of patients there. It was long-term for some who are recovering from some sort of health issue, and then there was some short-term people there. I think there was a guy that was just had a limb amputated. He was there. The place was loud, man. You couldn't sleep at night. There was people crying and singing constantly. This woman sang and sang. I should show you a clip. It's actually quite funny. And sad at the same time. So it was a real eye-opener being there. I kind of saw how, good off I have it and how healthy I am for a guy my age to only have actually had one piece of surgery, and that was tonsillectomy when I was 10. And then I think I had one stitch in my pinky nail one time when I slammed my finger in the door of my Fiat Spider, which is a pretty cool car. So getting back to my recovery, 10 days in the skilled nursing center. They gave me physical therapy every day, which was great. They taught me some new tricks, lots of core work. They all said you recovered really quickly, and they were ready to release me. So the second phase of this was to go to a halfway sort of house. I would be allowed to leave during the day and come back at 7 o'clock at night and continue to have my wound monitored and, kind of recovery and rehab. They decided I was too healthy, and they said, we're not taking him. So the Pacific Care Health Center said, well, we can't release you without somebody to come and get you, and I had nobody. So they're like, you can stay for a while we try to find some place to put you. And I was fine with that. And then they stuck a new patient in my room, which made me very upset because he couldn't speak, but there was nurses in there all the time fiddling with his sutures and the IV drip and all that. And I thought, okay, it's time to go. So I told the nurses I wanted to leave, and they're like, wow, you can't go. I'm like, I don't have a medical need to be here anymore. You guys know that. So they released me. But I want to make the point that they were saying you have to sign a against medical advice form because I was going to leave on my own free will. And I argued that I had already agreed that I was going to be discharged the prior day with the administrator. So I didn't really have a medical need to be there anymore. I was more or less under custodial care. So they did release me. But my point is, if you sign that AMA against medical advice and you leave, the next time you get surgery and you need to get admitted in one of these facilities, you're going to have problems because they're going to say you didn't stay the last time or you acted up. And also, if you get any complications from the surgery that you had and you leave against medical advice, it may not be covered under your insurance. So it's a good idea to get the proper discharge. It takes a little while, but it's just paperwork. It's just they sign off on your diet, your weight in and out, the stuff that you came in with. They give you your medication that they're supposed to be giving you, and they got me a taxi back to the hospital, which was great. My car was there. I was stressed about it when I was driving in because that was a big worry of mine. So the planning for this went a long way because I knew my car was going to be safe. I knew I had a backup plan. My sister could always come down and pick me up and brought me up there. I could have gone to a motel. I had searched a couple of them that I had within my budget and were clean enough. I had another friend of mine, homeless Marv. He would come and get me, but if he came up to the halfway house, they would probably keep him because he's a pretty crazy looking dude. The nicest guys you ever want to meet. He actually texted me a couple of times. He's like, you still need a ride home? And I didn't, but the whole thing came down to a lot of planning and a lot of mental work, and it was stressful, and it all worked out well. And I may have kind of overplanned it and overthought it, but here I am, back living the life in my car, getting in and out no problem. I've been taking it easy at the gym, just doing lots of work in the pool, physical therapy, lots of walking in the pool, back and back and forth at least once a day. I'm going to try to move into 2. I've been working out on the treadmill a little bit. I'm reluctant to get on the bicycle because that movement is too close to the incision area, and I just don't want to re-injure the disc because I like having the feeling back in my feet. I thought about how many things I missed out on doing in the past 2-3 years, and had the big journey on why these feet are numb and all of the shit I went through, the tests and blood tests, and we ruled out diabetes and all this great shit. So it's been a journey, and I'm happy it's over, and kind of gave me a new perspective on things. I'm pretty happy for a guy my age, and I'm super lucky to be in the shape that I'm in. So I hope this wasn't a big boring thing, but I think it was worth talking about. If you live in your car and you need surgery, you can do it. You just got to plan it out right. Make sure you have a skilled nursing center that will take you and your insurance. Hope that never happens to you. Thank you and have a great day.